The Whatcom County's Incarceration Prevention and Reduction Task Force meeting, the steering committee for September 7th, 2023. It's 11:03 a.m. We're meeting virtually this morning. Before we begin, we acknowledge that we are gathered on the traditional and unceded territory of the Lummi, Nooksack, Samish, and Semiahmoo people who have cared for and tended this land since time immemorial. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and difference. We begin this effort to acknowledge what has been buried by honoring the truth. We pay respect to their elders, past and present. Please take a moment to consider the many legacies of violence, displacement, migration, and settlement that brings us together here today. And please join us in uncovering such truths at any and all public events. Sorry about the glare. My printer died, so I'm got my agenda on my iPad. So anyway, welcome everybody. We still don't have a quorum, but I don't think we even have anything up for a vote today. Doesn't look like. So I think we're okay to keep going. Our first item is the county legislative agenda. Hi, Kayla. Thanks for being here. And
thanks for having me.
Yeah. And we got Tyler and Sept Paul from the executive's office as well. So I will go ahead and hand it off to you, Kayla.
Sure. Thanks, Councilmember Buchanan. So the county is working on formalizing its legislative agenda setting process, which includes more outreach to council, departments and boards and committees, as well as a little bit more focus on policy bills, whereas traditionally the county has been had more emphasis on budget requests. So I had some early conversations with Stephen, and I know there was some effort last year during session to coordinate with legislators on priorities related to incarceration reduction, prevention, and behavioral health, and just wanted to have this early conversation with you and perhaps the entire task force to see what you all think should be on the county's legislative agenda. We have some initial ideas, which I shared with Stephen, and I thought perhaps today we could just go over those and have some more discussion about what's missing from the list and where we need to put some more effort. Stephen, does that sound right to you?
Yes, it does.
Okay.
Thanks, Kayla.
Sure. So we presented to council in back in June or July, sort of on the initial list, but the biggest ticket item that I think is of interest to this group is the Medicaid waiver for jail-based health and jail transition services. So this is a core component of the Justice Project implementation plan. The State Healthcare Authority has already submitted a waiver to CMS, and that waiver has been approved, but the legislature will need to provide funding for the state's share of Medicaid to cover these services. And then the county will need to take significant efforts to prepare for implementation. So on the advocacy front, we are proposing that we work with the Washington State Association of Counties and other partners to advocate that the state take appropriate budget action to fully fund this waiver. Given that this is part of the implementation plan, I assume this committee is interested and supportive of this. I have not yet heard anyone I've talked to about this who isn't excited to get the state money to cover much needed healthcare services. So I've just been assuming this committee is supportive, but if anyone has questions or discussions about that, let's talk about it.
No, you won't get any disagreement. I mean, we've been putting county money in to do these services for too long, and I say it's high time. And just want to say also, I appreciate the leadership from the exec's office and yours too, in having a more organized front. This is going to be outstanding. So super excited and really excited that this is coming down the pike.
Kayla, one of the questions I had on this, A, I echo Mike's enthusiasm. B, I would have a question on what the scope of Medicaid coverage would include for this extended time period. And you know, we're planning a number of enhancements of in-jail services. And I just wonder if we know or can find out what would be in under extended coverage and what would not be. For instance, some of the strengthened reentry services in the jail, would they be Medicaid reimbursable or not?
Yeah, my sense, so I have all that information. So I have like the actual waiver approval document, so I can send that out to this group after this meeting. My sense is like healthcare services, including medication assisted treatment and behavioral health treatment, is covered, as is case management for jail transitions planning. That said, I'm sure there's certain standards and requirements the county's gonna have to meet. Whether or not we can meet those in the present jail, I think is a big unanswered question. So Stephen, like, I think we have the broad outline of it, but we're gonna really have to dig in to see.
Okay.
Does that make
and
sense?
where my attention would particularly go is a lot of what we're thinking is that would be a starting point for some navigational services,
Yeah,
which could be case management
yeah.
related to treatment, but might or
My
might
sense
not
is
be.
the intention and goal is for that to be covered. But like, obviously working with Medicaid and the healthcare authority, there's gonna be a lot of bumps in the road for each individual
Yeah.
case and implementation strategy. So care coordination broadly, jail transitions broadly is supposed to be covered.
Raylene,
Thank you. And my apologies, I missed a little bit because I was having technical difficulties when I joined in. But I know a concern that I've heard before is some individuals get medications in custody, and then when they get out, their insurance plans don't cover that type of medication. So then they kind of end up having to switch to something else that doesn't work. So then they drop off using any type of medication or try to self-medicate. Is this something that's going to help them stay on what they're prescribed while they may be in custody, while they may be restored and then brought back into custody and then leave custody? And is that part of the navigational program?
I don't know enough details to say for certain, so I don't know the answer. I don't know the answer to that question. I don't think this would change coverage for the type of medication that would be available for someone after release, but could enhance the coordination of prescriptions and those sorts of things, is my sense. Stephen may have
just to go to what I think is perhaps the crux of Raylene's question, outside of jail, the Medicaid coverage would be run through a managed care organization. They'd be part of a plan. I wouldn't assume, I would assume the county might be the biller for services in jail, and therefore it wouldn't be a plan. So I think it's that transition from the county billing to the MCO approving a particular medication might be the heart of what Raylene's concerned about.
Yeah, that's a good question. And I actually don't know whether the county or the MCO is the biller under this scenario when they're in jail. Perry may know.
Perry, go ahead.
I can share with you that psychotropic medication is paid for while an individual is in custody, and that is covered through interoffice transfer from the Behavioral Health Program Fund. I know that piece in terms of specifically the psychotropic medication or medication relative to mental health needs, because that cost has gone up fairly significantly, just the cost of the medication, and individuals that are incarcerated right now, as we all know, a higher level of acuity for individuals that are incarcerated as a group in terms of in need of medication. So I know that, and it's been a little while since we had the conversation, but I know that they were looking at this waiver, and that the thought process was hopeful that that could be billed to Medicaid as opposed to for a use of behavioral health program funds, 0.1% funds for individuals that were in custody, given the process moving forward. That's what I know.
Thanks, Perry.
And like, there's going to be a huge workload associated with implementing this waiver, which I imagine this task force and your subcommittees would be heavily involved in. So right now we're just as you all know, at the stage of making sure the waivers is funded, and then we need to have a lot more conversations around implementation.
Yeah,
Should I go to the next thing on the list?
sure. Go ahead, Kayla.
Okay, we've had a lot of discussions throughout session with staff, with the prosecutor's office, with the public defender's office, in the justice plan about prosecutorial diversion and competency restoration. And like, I think we're gonna continue to have those conversations around like what pilot programs look like. And as we develop those conversations, those pilot programs, and as the state's passing new policy that would increase responsibilities or offer options for counties to take on competency restoration, we want to make sure that we are asking the state for operational money to implement those programs, especially if anything has been a state responsibility in the past and is now becoming a county program. So we're not really there with specifics yet, but I think want to have ongoing conversation with this group and with the competency work group around what an ask would look like. And then just here is really a placeholder saying we want to ask for money for something associated with this.
Yeah.
Is that on our own, or is that in conjunction with the Association of Counties?
So the Association of Counties, my sense is that they've taken the position on this like local competency restoration options that they don't like this, that the state is trying to pass on state responsibilities to counties, and they've opposed some of those bills. And I'm not sure Whatcom County necessarily shares that perspective. So I imagine we will need to do we will track what the state association is doing, but specific advocacy around funding for local implementation would probably just be a Whatcom County initiative.
Any way to ascertain whether we have other counties as allies in that position?
Yeah, I mean, King County has some significant prosecutorial diversion programs. I don't know if they are getting state funding for those. I imagine they are. So possibly, and could reach out to Snohomish County and Pierce County as well. It would be interesting. I do not know that, but a good flag.
Kayla, do you know Cammie from Human Services at Snohomish?
Yes.
Oh, she'd be an excellent one to reach out to, I'm sure.
Okay. And then the county's legislative agenda is likely going to have some broad policy statements and sorry, Raylene and Perry had questions.
Raylene.
That's okay. So I know there's a lot of people that are still incarcerated waiting for restoration or competency stuff because there's no beds. Is the state willing to compensate the counties for that jail time when somebody's a threat to the public and they need to leave them incarcerated before they can be restored or moved to a restoration facility? Is that something this would help?
Maya, can you answer that question? If you're
sorry, Raylene, can you ask that question? What would help?
So since there's people that are currently incarcerated waiting for restoration and they don't have beds available and they're sitting there for too long, is the state able to compensate the county for that jail space when they can't be transported and they're just sitting there waiting?
I don't know of a mechanism to bill them for that. I mean, I shared, I don't know if you're with the competency work group, but I shared what we can do as defense attorneys is bring the contempt from the court, the contempt of court for failure to transport. And there's almost $500,000 just from January 1st to August 15th of this year that has accrued with those sanctions that we've filed. It's a different thing, but I don't know. I
guess when you're filing a contempt of court, and if they find in favor that there was contempt,
yeah,
can those funds be transported to the county? I mean, we're having to pay for that.
Well, exactly. Right now, the court is deciding because they ordered remedial sanctions and compensatory sanctions, sometimes occasionally. Rarely do they do the compensatory sanctions. Those are the sanctions that go to the defendant themselves. They almost entirely do remedial sanctions, which is contempt of the court, and those monies are paid to the court itself. They're the recipient of those funds, and how the court is going to use those funds is a very relevant question. One I've been asking of the judges, and they seem to be trying to formulate a plan that has something to do with establishing guardianship for individuals. I mean, I sent a list of ways I thought that the funds should be spent. I think I started with housing for people, but they seem to be going on this path of setting up guardianships for people. But yeah, it's potentially a large amount of money, and how it will be used, I think, is the judge's decision. Whether the jail could try to bill the state, that I don't know. That seems like sort of maybe a county prosecutor from the civil division who represents the jail. That's not something I feel equipped to answer.
Tyler, you have something on that?
No, I was just going to concur with what Maya was saying. There is, it's probably best to start with the contempt sanctions. You would have to have a statewide agreement or some way for the jail to reimburse the time of individuals sitting in the jail directly with the state. And I think that process would just take a while, not to say it's not a good idea. So I think starting with the contempt sanctions is where Kayla and I have chatted a little bit with the judges, and trying to determine exactly how to collect those dollars and how best to utilize those dollars.
If I could interject here, I think the contempt avenue is a good one. It's a punitive one against the state trying to kick them in the butt to move along. But I think the other question is the county is incurring expense, and it's not the judges who necessarily ought to control that. So there might be a separate policy kind of initiative that would direct DSHS or the general fund or whatever to compensate, to reimburse counties for the incarceration expense, not as a punitive measure, but as a compensatory measure. And that shouldn't be at the judicial officer's discretion or Eric's or anybody else's. It could be a statutory requirement.
I totally agree, Stephen.
Perry.
It's along the same lines as some of the information that we're talking about, but I just thought I'd also let folks know that our competency restoration work group is going to reconvene in September on the 15th, if I recall correctly. We took a bit of a time off there, and we have Jason Karpman coming he is from the Office of Forensic Mental Health Services. I was in a meeting with the BHASO, and Jason did some presentations that surprised me a little bit, to be honest, and I'm still doing just a little bit of research. The Office of Forensic Mental Health Services, Behavioral Health Administration with the state actually has available funding that can be utilized for development of prosecutorial diversion programs. Now, my understanding at initially with the True Blood plan was, we talked about King County and I think Franklin County and Pierce County were all sort of in that first wave of getting funding for prosecutorial diversion programs. And when we had talked about that initially in this work group, it's like, nope, that's not available. You really can't access that. What I'm hearing specifically from Jason Karpman was that indeed there are available funds specifically for prosecutorial diversion. So it wasn't related to some of the topics that we were touching base on there. But I'm wanting him to talk about that, and then wanting him to talk specifically about, okay, steps, that Whatcom County could consider relative to, developing that particular resource. So again, it wasn't related directly to what we're talking about here, but, related in an important way, I think, as well. And I wanted to share it.
Anything else on this particular item?
Kayla and Tyler, can you join that competency restoration work group meeting for that presentation?
I'm sure one of us can, yeah.
I
Great.
think that both of you are actually on the distribution list, so if you have questions, you can certainly touch base with me.
Harry, is that the same gentleman that came and gave a presentation a year ago or so?
No, same office, but different, entity within that. And as I said, I was caught somewhat by surprise because there were, funds available specifically for, the diversion programs, which we've discussed, pretty extensively. So different individual, different topic. So I'm looking forward to that.
Great.
Yeah, me too. Anything else on this particular one, and then Kayla can move to the next.
Perry, if, when they're researching that at the next meeting, is it possible for you to look in to see if that would include, money for staffing? Specifically prosecutorial and defense, if, they can provide funding for special staffing for that?
I sure can. Look, looking at the scopes of that, really, and I'll make a note and ask that question. I was actually going to do a little bit of emailing with Jason before he came and presented, just for some of my own edification and just sort of framing this up. But you're curious about funding related to staffing. How specifically?
I know that there's already a shortage of prosecutors and defense counsel. And if there's funding to fund these programs, they may need additional staffing to work on these programs, and they may need specialized attorneys in that area. So if we can divert some of those funds towards that with a program, that would be beneficial, I think. If you have any ideas on that, please weigh in.
Got it.
Thanks.
Mike.
Hi, I didn't know whether Kayla, if you were done with your list of kind of the advocacy platform pieces, but one thing to add, there's a really ambitious plan that we're embarking on to build a new facility. And also in that is a lot of ideas about housing people as one of the ideal diversions. And I feel it would be amiss when we're talking about diversion and getting monies, because Whatcom County will need money from the state to do any meaningful lift on getting housing for people who are otherwise incarcerated because they lack a home. And I don't know what way, shape, and form, but just, to put a pin in that, I suppose, is there any way that we might include that in advocacy efforts from the county, specifically to help us address this really ambitious plan to house instead of jail?
Yeah, thanks, Mike. I expect housing to be a cornerstone of the county's legislative agenda, sort of from workforce down to homelessness. And those efforts will be really just supporting statewide advocacy pushes and from the Washington Low Income Housing Alliance, Association of County Human Services, CAP agencies for housing investments. Last session, the executive was supportive of additional local options for housing funding, and I expect will be again. He's here, so can speak to it. And then my sense from council is they're going to be supportive of that too. I don't know that we will have a specific ask this session as it relates to the justice involved population, but I think more just throwing our support fully behind increased state funding for housing, and then planning locally to implement projects that would utilize that state funding for housing justice involved individuals. If that sounds right to you.
It sounds totally right. And you said the key word. And I think that's one of the things that's missing. And I've lobbied with the Low Income Housing Alliance, so I'm really a big fan of their work. What I don't see is kind of earmarked, if you will, or specifically intentional for the justice involved. I really appreciate the way you said it, because I think you're getting at something that we've been missing. And I think sometimes we do need to focus. We do need to look at subpopulations. And I think our county would really benefit from some of those dollars. And we've seen here that those programs work. So thank you. And you said it beautifully.
Okay.
All right, keep moving us through the list.
Okay, so the next one is really efforts we will be tracking policy bills on and supporting, and probably proposing to council we make a bold policy statement on, as opposed to like a specific initiative, but it's really around ensuring that the behavioral health system is adequate to support all populations who need care, including the justice involved population. So this would include ensuring appropriate Medicaid reimbursement rates, assuring that state RCW and WAC allows for proper Medicaid reimbursement at the proposed crisis relief center, efforts to bolster the behavioral health workforce, and really just pushing the state to fully assume their responsibilities for behavioral health care in Washington state. So so that's that. I would say our staff is tracking the WAC development around crisis relief centers and Perry. And then Eric and our health department are working on that, and we'll flag any sort of legislative or changes that would be necessary. That's going to be an expensive program to operate, and we want to ensure that state funding is utilized as much as we can through reimbursement for the MCOs. So that's kind of the last thing. We are not sort of proposing at this time an additional capital ask around justice project implementation projects or additional inpatient facilities that would be sponsored by Whatcom County or owned by Whatcom County, but are working with partners such as the Lake Whatcom Treatment Center to see what they are bringing forward for capital asks and how we can support them, but would certainly welcome this group's input on what we are missing, if there is a desire to push forward on any capital asks related to the Justice Project, and then on the policy side, what we are missing. And just, we're still really early in the process. I don't expect council will finalize an agenda till like late October, November. So there's plenty of time to change course or make additions here.
Any other thoughts? Stephen?
Thanks, Kayla. I guess I have a couple questions. One is we have sort of reached the point of acknowledging the need, but hit the wall on what to do about data system and data gathering and dissemination. And that's got to be a key part of the implementation plan if we move forward with that. It seems to me that that's an appropriate funding request kind of agenda item. I'm not sure we have enough definition in our own minds yet to formulate that, and I don't know if we have time to do that. But is that something that we could add for a county item? Or we're certainly not the only county facing that problem, and probably could assemble some alliance there as well. So that would be one thing I'd ask about.
Okay.
The other is, it seems to me, and this comes from last year's belated agenda. I appreciate your touching on the Medicaid reimbursement rate issue. I would urge that we emphasize that more than it sounded like you were doing in a package of assurances, because we're at the high end of acuity and the high end of skill level for supported housing, case management, and treatment providers. And we've heard from the providers quite often that that's really demanding work, and to recruit and maintain a workforce there. Medicaid reimbursement rates, which HCA seems to consider fungible across positions, just isn't cutting it. So to target some money there at the high end would be valuable. And then lastly, also from last year's agenda, Tyler and Erica put together a plan for the downtown sort of one-stop kind of entry point as a capital request. And have we given up on that for this session, or what's the status of that idea, which I thought was a useful
Yeah. Tyler Tyler may want to speak to it more. My concern with moving something like that forward right now would be the sort of the operational funding concern as we are working to get the crisis relief center off the ground, and having a better projection of what those costs will be before we add an additional local commitment to operate a new program. But Tyler, I don't know if you,
Fair enough on that.
yeah.
Yeah, no, good point on that, Kayla. And then also just recognizing it's a short session this year, and that next session is the full session, and we'll probably be in a better spot to take the year and a half to determine what the consequences are and how best to accomplish that type of project, and then ask for the state support at that time. I think it's just better. Yep, Stephen, I had a question on your second item that you brought up, because your first item was data, and I think that's a really good point. I think we're going to have to do some investment locally, and the justice plan has 2 data positions and a couple others, and so we have that. We're tracking that for a 2024 ask to council to hire those positions and do some additional work. So we should see that investment coming forward. The second one was on the Medicaid HCA, and making sure is a higher priority than just kind of included in the rest of the legislative ask. Was that right, Stephen? Did I hear that correctly?
Yes, trying to target some enhanced reimbursement for these really demanding specialized workers.
So I will just recognize that it is definitely high on the 40th and 42nd list. Kayla's been in good conversation with the senator and a couple of representatives real recently about next steps and where to go. So they understand the importance from our standpoint, and I think we'll be able to kind of raise that higher on the priority list as we continue to lobby for those efforts.
And I think on Stephen, on that one, I think you're right that I didn't sort of emphasize it as a county lead item. I think we don't see the county being in the lead. We see like associations of behavioral health providers, WASAC potentially being in the lead. And so our work is to connect with those organizations and ask how we can support them. But point well taken on its importance, and us, signing in on bills that other organizations are initiating, and ensuring that there is that advocacy push. And if not, then seeing what we need to do to take some leadership ourselves.
I suggested an emphasis on that, Kayla, because in discussions others of us have had with providers individually and as a group, they tend to try to wring as much out of the existing structure and processes as they can. Whereas this is a sort of a different way of looking at reimbursement rates that HCA doesn't have on its radar. And I'm not sure the association would try to create out of thin air. So somebody's got to push it, it seems to me. I mean, that was our thought last year.
Stephen, I mean, other than Perry, I dropped my notes. Other than Perry, I don't know that we have the expertise like on staff to be able to articulate exactly what the ask is. Do you feel like you could do that or collectively we could do some work together to better articulate precisely what we were asking for? Like, I was planning a broad policy statement that just says essentially like, we support higher reimbursement rates for the full coverage of care for, all of these reasons, and then tracking bills associated with that. But if you feel like there's a more specific ask that we can use to guide us as legislation comes forward, that would be helpful, I think, to me, and would defer to Perry on what sort of additional information is needed.
Well, Mike was waist deep in this last year also.
Yeah.
So we had some text that we forwarded to our reps. I'm not, Perry saw that too. Maybe the three of us can put our heads together. I don't know what your thought is, Perry, or yours, Mike.
Disability Rights Washington, I think sometimes we can find a champion agency as well that might have created or done some research around this. And I think, Stephen, we availed ourselves of some bright people around the state to help frame those particular arguments. And I'm happy to help in that.
Yeah. Could you guys send me whatever you have from last year?
Yeah, we can dig that out.
Of course.
Thanks.
Yeah, for sure.
So, Caleb, what is the next steps for state asked for the 23-hour crisis care facility? We didn't talk about that.
Yeah, so we are not expecting to ask the state for additional capital dollars. Feel very fortunate to have the $9 million that Representative Rule helped secure. So we expect to fill the gap with local funding or perhaps even ARPA funding. And then on the operational side, just ensuring, like, like we discussed, that the state is doing its part to cover operational costs at the patient level, as opposed to sort of like a general operational subsidy. So I don't know that there's a specific state ask with regards to that, but as we get further on modeling the operational costs, we may have a need.
Yeah, and that's where I was coming from, was the operational
Yeah.
side. Yeah.
Yeah, I don't think we're planning to ask for like a facility-wide operational subsidy. But if we see a really significant gap as we get further, then we're gonna have to have that conversation.
Yeah.
And you
All right.
remember that original legislation, the language in the legislation did direct that operational funding would be addressed. But it was very, very general. So we may go back and start there
Yeah,
in referencing.
That's kind of why I asked, because I remember that as well, Perry. So
Yeah.
Okay, that's a good flag. I will take another look at that language and see where we need to dig in.
okay. Anybody got anything else about legislative priorities? It's been very helpful, Kayla. Thank you so much.
Yeah, and just I think you all know how to get in touch with me. But just feel free to contact me anytime if you have additional ideas, materials from advocacy organizations or other work that you do, and we'll try to get as much support as we can for anything that would help on the behavioral health or incarceration reduction or housing front.
Great.
Before we close this, I'm glad we have Dan on the call, and Dan's been a champion on behavioral health stuff also. So I'm just wondering, Dan, if you have any thoughts on legislative agenda. And maybe not.
Maybe not. Okay, we're going to move to our next item, which is to talk a little bit about the some of the policies that we've been talking with legal about as far as boards and commissions with regard to the ballot. There's Dan.
Hey, sorry about that. I'm doing this on my phone, which is basically impossible. Hey, I like what I hear. I think that and I like the long-term plan as well. I'm glad that we're getting ahead of this. So I don't really have much to add, but I like the way the conversation is going.
Great, thanks, Dan.
Yep.
So once the ordinance for the ballot measure for the new corrections facility was approved by the council, we basically have now shifted into it's in a campaign mode. Therefore, the governmental entities have to abide by certain rules that have been established, that you cannot use public funds or public employees to promote or go against a ballot initiative or a candidate or anything in an electoral process. So what we're doing is just making sure that all the boards and commissions know that that's not a discussion to have within your meetings as far as, go jail or whatever. That's just something that legal is wanting us to stay away from. I'm not going to read it because it's in your packet. There's a statement that'll just go into agendas that just kind of like our land acknowledgement. It just is a statement about what we need to stay away from, and that's really all this agenda item is about. Kind of just an FYI that both from the council level and now all the boards and commissions, they have to make sure that they're not promoting nor opposing the ballot measure in their conversations in their meetings. So just wanted to lay that out. Any questions about that? Okay. Next item is the task force leadership planning. As many of you know, Stephen and Jack are termed out at the same time. We've tried working through legal to find some options to be able to keep one or both of them on. But the requirements for terms for boards and commissions is actually in the charter. So it's not like we could just change the ordinance for the task force and rearrange those term limits. We can't do it because the charter itself establishes that. So what we want to do today is just talk a little bit about what we think we need to do as far as kind of a succession plan. I'm gonna let Stephen kind of weigh in some of the ideas that we've, talked about in a couple other meetings we've had earlier a few weeks ago. So Stephen, you want to give us any thoughts?
I didn't know I was going to be carrying this ball, but
Well, I was hoping, I didn't know Jill wasn't going to be here. I think Jill would have had.
yeah, you and Jill have sort of been working this a little bit.
Yeah.
I think there's some concern about continuity of leadership, institutional memory, participation on some of the subcommittees in a substantive way, but also the facilitative role that Jack and I have played across much of the business of the task force. So there have been some ideas floated, and I would rely on you, Barry, to know where they stand now, if they are still afloat, to somehow designate or ask the task force in January or February to approve non-member facilitation. If you remember back to the beginning of the task force, the county contracted with WAHA first for facilitative services of the task force. It did have a member, that was me, but they also had staff facilitation. So that would be one possibility. The other was where the term limits from the charter and the ordinance come in is on the smaller number of appointed members from community sectors on the task force. There are also a larger number of permanent members who represent identified entities, mostly public entities. And so I guess Jack or Barry had floated the idea of amending the ordinance to name a transitional permanent member as one of us. And I think where the last I heard was you were going to run that by Karen Frakes.
Yeah. And unfortunately, it looks like Karen dropped a penalty flag on that one. So I don't have, that's why I wish Jill was here. I think she had the conversations with Karen to know exactly what the specifics were. Jenna, did Jill pass any of that along to you at all?
No, she did not.
Yeah, but what I got out of it was a no-go, but the reasoning, I would have to dig a little deeper to find out what that was. But yeah, unfortunately, that's not going to work.
Yeah, there have been a number of pretty creative proposals that Karen hit for reasons that haven't always been persuasive to some of us, has rejected. So in terms of, that's what I can report at this point is we've tried a number of possible ways to maintain some continuity, and we haven't come up with one. So we either need to come up with another one and hope that for the first time Karen doesn't find fault with it, or think about how we go about pretty quickly coming up with a candidate for and a process to maintain some continuity of leadership, or to install new leadership, even if it's as discontinuous as it looks like it might be.
Yeah, I think that given the time frame we have, that's almost got to happen parallel. Maybe we can think of something creative, but I think we should be proceeding down the path of what do we need to do to fulfill, to fill those leadership spots. Mike?
I was just gonna chime in, so I'm a non-member, right? Not officially appointed, just here by volunteering. I just know what an enormous lift that is. So when Stephen talked about the role of WAHA and that the county was paying for some of that facilitation, I just want to echo that that could be really valuable. Not everybody has time like Stephen and Jack do in the private sector to be able to do that. And they've, occupied and held that, stewarded this group for a lot of years, very well. And I don't want to say that's a unicorn and you won't find that, but I just want to be realistic and say we might want to think about, can we put our money where our mouth is? If we feel this is important and this is our Law and Justice Council and some other pieces, right? We value, I think, the Incarceration Prevention Task Force, its leadership and its partnership. So just want to echo that maybe returning to something like that could be valuable in the event that we're not able to have that continuity. Maybe we buy the continuity. Maybe we do it through staff, and then we have allied people like me who can volunteer and help and do subcommittees and participate, and hopefully actively, but to not expect to find another Stephen and Jack, because we may not.
I think what you're saying is viable, but time again is of the essence. So what we would need to do is figure out what the costs would be for that and put in a mid-biennium adjustment. So the council could move something forward into the budget cycle for next year. And that would have to happen relatively soon. Stephen?
Yeah, I just wanted to say for everybody's benefit that I started to scratch out a sort of a job description kind of list of the kind of skills or traits we were looking for. And Jack and I have really filled a couple of roles. One is that meeting facilitation. Both of us come out of the community, so we have sort of a no turf kind of aroma around us. And both of us have had the time to put into participating on a substantive level in the actual work, not just facilitating meetings, but the kind of brainstorming that we did with Kayla and Tyler just a few moments ago. And so those are different skill sets, really. And I do agree with Mike that it might be challenging to find analogs for either of us, and maybe that's an unreasonable goal. So I think one of the things is to get a sense of what our priorities are in terms of facilitation, participation on a substantive level, and credibility across all the stakeholders, I guess, familiarity with the systems. A lot of things to factor in there.
Yeah, Dan.
Yeah, this is super important. I want to make sure that we get this right. I'm wondering, kind of to Mike's point, is there anyone? Are there vendors within the RFQ roster that could fulfill that role if we went in that direction?
I would say yes. I think Holly O'Neill would float to the top of the list for me because of the work she's done with the Justice Project. So she's got a lot of familiarity. So her company Crossroads would be, and they're on our roster, the roster for MRSC roster.
Okay, if I can just follow up real quick, that was kind of what came to mind, just because that company did the Justice Project, the SAC, and has a lot of familiarity. I think that's that kind of that knowledge is very important to having someone coming into the fold who does not understand the history, the context, the complications, and the things that we're facing would be a big mistake. So I'm all for trying to bring in someone that has the experience. I do think that asking one or two people to be co-chairs it's a huge responsibility. I do think that we need to look at do we compensate for that moving forward, and then looking within the own within the field of the folks that are on the task force. Are there any natural candidates that we could consider within that? So that I see that as kind of the two different directions that we could be taking.
Other thoughts? All right, well, let's keep this on the front burner. We will be getting back to you again at our next steering committee meeting. And Stephen, do we need some sort of an agenda item, maybe on the task force agenda at some point?
Yeah, I think we need at least a status report, and if you do some inquiring or there's some further internal discussion of this that you could update us on, that would be valuable.
Okay, I think everybody gets back to work next week, so we might be able to get a little more traction on it. All right, we'll move to the next thing. I believe it is Mike. Yes, Denver-based supportive housing project.
Thanks, Barry. So this floated across my desk. Some of you may have heard of this project, but the Corporation for Supportive Housing was involved in a pay-for-performance project in the city of Denver. And the reason why I thought it was particularly salient, well, multiple reasons. It's justice-involved individuals, and it's really a lot about what we've heard in the Justice Project and what Kayla has been briefing us on about, the importance of investing in housing for justice-involved individuals. What they did is a study, and I think why it's particularly useful, if it's all right, I'm going to go ahead and share my screen and at least show it briefly, and then I believe you all will get the link to this. So give me just a minute, I'll bring this up, and then of course we can share the link. Can you all see that?
Yeah.
You're right. Thanks, by the way, Barry and Stephen, for letting me bring this to y'all's attention. So, this project has been a long time in the making, and it was actually completed years ago. The reason why this is coming out now as news is because a fully created report has been done. So I want to highlight just a few things about this study and why this could be useful. One, obviously it's a bigger community than we are, but they really had very similar problems in front of them. They found themselves arresting and jailing people that were experiencing homelessness repeatedly. And many of the professionals, people working with them, people in the courts, police, and housing advocates really realized, hey, we can house these people instead of jail them. What they were looking at is a funding scenario, though, that was very difficult. They didn't have a lot of money to be able to do this. So a pay for performance really gets private sector investors to invest up front, either build brick and mortar apartments or to create rental subsidies in existing apartment stock. And then what the benchmarks are set for, reducing recidivism. When the project is successful, the partners get paid out, and Northern Trust was one, for example, that invested in this project. At the end of the 5 years, the project met its goals, surpassed its goals, Northern Trust gets paid out. So it's an interesting way to leverage private sector funds and public sector funds in something that really benefited the entire community. To my knowledge, we really haven't taken advantage of this in Washington State. I really haven't seen this much in Seattle. We're still doing it kind of really with a bunch of nonprofits trying to lift up housing for justice-involved individuals. Really quick, I'm going to go ahead and just move down. So it is called the Denver Social Impact Bond Initiative. We will go ahead and share that link with you all. I think it could be something, and I would advocate that for those in the county who are looking at housing for justice-involved individuals, possibly as a part of the Justice Project, right? That this could be an avenue for when we get stuck with, well, what about state money or what about federal grant money? Could we leverage something else? So very quickly, some of the key players in here: Colorado Coalition for the Homeless. So that got together your kind of nonprofit folks. They're actually a housing provider. So that was kind of your folks that knew how to do housing, permanent supportive housing for justice-involved individuals. And the Mental Health Center. Those are the two that did behavioral health and offered the housing. And then they leveraged in this pay for success model, private investors, and that included nonprofit foundations and for-profit companies. I'll read this last part and then I'll just open it up for questions. And this is really to bring it forward and to see if this is something that we want to explore more as a task force. I'll read this last sentence. The program was so successful, the private investors received their total investment from the city plus $1 million in return. Northern Trust, one of the for-profit investors, agreed to share $250K of their return with providers. So really, this shows, I think, when you dig into this, and I really encourage our members to look at this and to read this, it shows that housing people, instead of jailing them, not only does it saves so much money that it creates a profit. And it was a unique way to try to harness this. So I will stop there. I can show anything more that people want. And then I guess my suggestion or my offer is, could diving into this and maybe we could get somebody to actually present on it to the task force. Would it be useful, or would it be useful for the county as it's viewing its investments in affordable housing and going forward with implementation of any justice project? And with that, I will.
That's awesome, Mike. Thank you.
Yeah.
Start with Sept Paul.
Thank you for bringing this, Mike. I've been working on it for 3 years. I just wanted to know. We also call it Social Impact Fund. And I have been in touch with Whatcom Community Foundation. Of course, we had another consultant to help us from Montana. And I had some conversation with local builders or large construction developers. And they showed interest in that. I have not been able to carry this forward further, which I would have thought. We were starting with a $50 million fund. And it is one of the things sitting on my desk here to look at every day. I want to know a little bit more about this because there could be a different methodology, how to get that fund, how to invest it. So I would stop there. And I think that it's a great idea. I always believed in it when I came to this office. And I think that we have explored with our treasurer and with the state that we have a $500 million treasury funds at almost all the time in Whatcom County. We've been asking the state treasurer, he came to visit me here in our office, and he also supports the idea that allow us 5%, no more than 5%. And out of that, we will not put that money no more than 25% in one project. Like we wanted to get some leeway that the funds we are sending to New York, we're getting like 0.25% return. We have all kinds of reserves for all different organizations. Whatcom County handles that. So there is a great potential for that. And we wanted to take at start $10 million, put as a seed capital for the Social Impact Fund. So we talked to our treasurer. He also thinks that it can be done, but I never made it to the council. So we'll talk more about it. It's a great idea. It's very doable. And if I can get more partners together or this task force want to do it, I'll be all for it. Thank you. And I have another meeting to go to, so we'll see you later. Thank you.
So Mike, one question would be, you mentioned to find somebody to present it to the task force. What does that mean? What are you talking about?
Well, I was just throwing it out there. We might be able to, for example, Corporations for Supportive Housing that helped author the study. Debbie Thiel works and lives in Washington State, works for Corporation for Supportive Housing. She regularly presents to organizations and individuals, and she would be ideal, I think, were somebody like that in her role that works for Corporation for Supportive Housing, because they're close to it. It was really their evaluation role in the Social Impact Bond Initiative in Denver. And I think it would be much more polished than just having a volunteer like me who just gets tickled by amazing, stories that we hear on the internet. So that was my thought, was maybe, if the steering committee agrees that this would be something valuable to put in front of the task force, that maybe with Jill's assistance, we reach out and see if we could get a presenter. But that I offer and see what y'all think.
Well, I was going to suggest the same thing, just to poll the group here to see if that's something we want to move forward with. I would like to move forward with it to get a presentation anyway. I see a lot of nodding heads. Let's work with Jill. She gets back Monday and we will start reaching out. So Stephen.
Yeah, I like the idea of the task force sponsoring this. I'd like to see it sort of be a community presentation, because I think the scale of this is bigger than, and we want it to be bigger than the task force as well. So the sooner we can start talking to people outside our small circle, the better. I like Satpal, I was thinking of Maury and Pamela at Whatcom Community Foundation, especially. Unlike Satpal, what struck me about this was the kind of rent subsidy kinds of things. I think Satpal was talking about building and developing housing, which involves massive amounts of money. I think you could have an impact at lesser scale with rent subsidies and dispersed housing supports, because you're going to need money for pretty high skilled supportive services in the housing as well. I haven't read the study, so I may be wrong about that. But this is a big project, but social impact financing is really something I think would light a fire here locally for a lot of people. It would be nice to be public-private with something like this as well.
Yeah. Tyler?
Just following up on Stephen, yeah, I think the Community Foundation would be a great connection. I know that they had some original conversations with St. Paul on that other idea. And they were very interested in it. Mike, how's this thing work? So there's a social impact fund that is helping to pay for rent subsidies for individuals that need supportive housing in nonprofit or private housing facilities?
In a nutshell, you've nailed it, right? So they're essentially diverting people that would normally have gone into jail. Instead, there's a whole study in it, right? So people were offered an opportunity for housing or not, and they studied the groups. They looked then at the costs associated with those individuals in housing, because that's expensive. As Stephen mentioned, they're getting supports, they're getting rental subsidy and existing. I don't think it was construction projects, Tyler, to answer that. I think it was more along what Stephen was talking about, but it covered all the rent, which is no small thing, all of the diversion resources and case management for years. And they tracked it, and they tracked in multiple areas what those costs would have been, usually governmental expenses. So that's often to jails, to courts, but it's also to the public health system. And then they kind of compare over time what that was for the person that was just on the streets and frequently incarcerated versus the housed individual. They tracked it over 5 years, and then you get some details. Now, how they funded it is part of the really cool part. In the pay for performance, what they did, normally we go to grants, we go to the legislature, we beg for a bunch of cash, and we try to lift it up on our own. What they did is they went to private investors, enterprise investors, to get some of that funding. And now, of course, they use nonprofit funds and some other ones as well. But they really brought in the for-profit sector and said, hey, if you get behind this, if we make these benchmarks, not only will you make all your money, but you'll make a profit. So
how did they get return? How did they make profit?
Yeah, that I don't know all the details of that, but they actually got their entire investment plus a profit. And it must have generated, maybe it's through the abatement of other, they must have created a mechanism, right, to recapture those cost savings. And that's one of the key things that I think housing providers or any social service providers is looking at for a whole time. We know when we do our job well, people are arrested less, they cost less, they're in the emergency room less. How do we recapture that? So I'm not positive as to the mechanism, but in some way there must have been a recapture of some of those funds, a tracking of those funds that allowed for then profit to be paid out to the corporations. And, I think people have said for a long time in our kind of the nonprofits can only do so much, right? But can we attract in some way for-profit corporations who would get involved in this community solution. So I wish I had more information. I think we need an expert, but
No, and I'll take a look and research a little bit more. I was just trying to figure out that model. If it wasn't like capital and they weren't making investments, it was more like rent subsidies. How do you get the return at the end of the day? So I'll do some research and think through it. I
Mike,
love the opportunity and the idea. I just have one last point. We can't do it with a 1% vacancy rate. So like there's a total housing issue in Bellingham and Whatcom County, and at 1 or 2% vacancy rate, it seems very hard to accomplish something like this. You probably need a much larger, more healthy vacancy rate associated with it. But I love the idea.
Mike, do you know if there was any tax incentives involved? Or is that part of maybe that money?
I want to say it used like some EDI funds or something. I don't know all the details of that, Barry. I'm sorry.
Okay. Raylene.
Thank you. Mike, I have 2 pointed questions because I like to add multiple things. So one would be more of a data gathering, and since I haven't read the article, maybe you can fill me in. Was there any data on ethnicity or healthcare needs associated with this study? That's the first question, as I want to try to make sure that if we're looking at this, that we can somehow implement GARE. The second part would be maintenance and DV charges. Actually, it's kind of 3 parts. Sorry about that. So maintenance costs for assisted housing is always something that I have concern with, because I know when people move out or there's damage to buildings or maybe there was drug usage, then those costs have to be picked up. Was that something that was looked at associated with this study? And then domestic violence charges sometimes prohibit individuals from getting housing because people don't want to rent to people that might have those charges, might have convictions for those, could cause more damage, could cause more issues. I think there's actually statutes that restrict some individuals from getting rentals from that. And so those are some concerns because those people still need housing too. And I don't know if any of the study actually focused on those items.
I looked very briefly, and again, I haven't read even the entire study. I'm familiar with the project over the years. They looked primarily, the type of cost that they associated or the costs averted were primarily the criminal legal system cost. They also looked at costs of sheltering, right? So they looked at kind of what was this person incurring, and those are the costs that they mentioned in the study. As to demographics, I would assume that they had all of those. Again, I haven't looked at the complete data set, but they usually look at what's called REL, which are race, ethnicity, language, in addition to other like age and normal other characteristics. So I would think it would allow us to dive in, but again, I don't know all the details. And as to your point about the people are randomly assigned. So one of the reasons why the study is useful is because with random assignment, you're really getting a very big mix of people that were assigned to either get this intervention or not. And that's one of the ways you can make it really statistically significant. If you were handpicking people, it wouldn't function. So to your point, Raylene, obviously they look at the demographics, but people were not handpicked or chosen. It was kind of all randomly assigned, and that's part of the rigor of the study. And the study is out, by the way. It's by the Urban Institute concluded their study. That's why it came up on a news thread again, because it concluded in 2020, right? So this is not news, but the study with the deep data sets that's out is news. And I hope that answered that a little bit, Raylene. And sorry, I'm not an expert on this. I'm more just kind of bringing it to the group. But
Thank you, Mike.
Kayla.
I was just gonna sort of related to what Tyler was saying. If we are gonna invite CSH to come present, Mike, if you're reaching out to them, could you ask them for like who they would recommend on the actual like funding mechanism side of how the program was designed, and see if we could get contact with them as well, because I think we all right, like intuitively know these results about the cost savings and believe in that, and it's a matter of like logistically how to recapture the public costs spent on incarceration. that
So
we struggle with.
you're specifically interested in the corporate partners or the folks that teamed up with
I am
government and
interested in like any transaction where money changed hands and what that was for and who paid who for what.
Mm-hmm. Makes sense.
Yeah.
Dan,
Okay, I guess I'll be the third person that says, yeah, we need to understand the mechanics of how this is going to work, because to me, it's like I just don't understand on a rent subsidy basis how the return on that would materialize. I get it from the capital side, but I don't understand it from the rent subsidy. So like having the mechanics of how that would work would be super helpful. We'll have to explain it to our constituents, our folks that are leaning on us to understand this process a little bit better. And then to Tyler's point, yeah, we can't do this in a 1% vacancy rate market. So I think that we need to start thinking a little bit bigger, and this is beyond the task force's purview. But I think we really need to consider whether the county or the city or both could look at possibilities of public development authorities, and what could look like in terms of generating housing. And I'm not talking about building, 1,000 units of housing. What I'm talking about is, could we pilot a program where we have one or two buildings with 40 units each or whatever the number is, and we build the buildings, and then we use those facilities for this express purpose. And that would at least get us the units on the ground. Right now, it's rough out there. So I don't know how that would work in our current market. So I think we need to think about just think of things a little bit differently when it comes to the production side. That's all.
Stephen.
Yeah, I pretty clearly sense interest in the whole group and finding out more about this. I think the kinds of questions that are being asked are really good ones, really necessary ones, and speak even more strongly to the value of bringing in one of the knowledgeable people to talk to us. I'm going to suggest, from other things the task force has done, you take a promising practice from some other place, but you've got to fit it to the circumstances of the locale. So I think Tyler's point about the vacancy rate is one example of that. And I'm going to suggest the council may want to think of freeing up some money to hire a feasibility consultant, somebody who knows this kind of thing, but could come in and learn about Whatcom County and say, well, this would work here, but that wouldn't, and here's an alternative. So actually moving toward a planning phase or a feasibility phase of this, which would be an expense, but a worthwhile one, I think. And I guess I'd ask, I heard both that Jill might make this contact for a presentation, or that Mike might, and we should just clarify who's going to take that step for us.
Well, I will confer with Jill because she's our staff person. So I will talk to her on Monday and find out how she wants to do it.
And Barry, I'll offer as a bridge, right? I mean, if we want to get somebody from CSH, I think that might be obtainable for us. Urban Institute, I don't know, has a rep here. And Debbie, like I said, normally presents quite frequently. So I think that might be obtainable, but I'm happy to be a bridge or a link, or if Jill says, who is this person? Do you have an email address? I can help with those things.
Well, I think we'll definitely loop you in as a partner in making this happen, Mike. So for sure.
Yeah. To answer what Tyler said and what Kayla was getting at about the money, I looked just briefly a little bit more, and it was about 8.6 million they did not construct. So to Tyler's point, they were the capital investment, as it were, didn't build anything, but it did obtain it. It paid for rental subsidies. It paid for the support services, for the diversion services. And it was a pooled fund. And then the city of Denver signed a pay for performance contract with the investors. And it's not totally clear how all of that did. I think the city tracked most of their expenditures. They did include, by the way, expenditures in detox. So the city was looking at what they were paying in detox, in police, jail, courts, and used that as the cost reductions in that generated the pay for performance, or the profit, if you will, to the investors.
So, that's what I read too, and that all sounds amazing. Until I try to figure out the mechanics of the cost reduction from the local jurisdiction. Because running the jail doesn't cost any less on an annual basis if there's 10 people less in that jail. Because our operation costs are the same on an annual basis. So somehow, and maybe it was just that Denver is recognizing the social benefit and investing into that, and they're not reducing their costs on the other side, they're just investing into it, and so making the investor get a value off of it. But that's the mechanic I'm trying to figure out, Mike, is and maybe they're just paying for it because there's good outcomes, and
or maybe they looked only at variable cost, Tyler. Maybe their jail was so oversubscribed that they're contracted with other communities, and they can actually identify for this study group of 761 souls. We can actually track 100% of this as variable because they were, and I don't know the particulars of that. That's a really great question. My hunch is though that it is variable. It's more based on variable costs, but this is a really good research question to find out. How did they base it? Because you're right, those things, the police still have to be there, the court still has to be there. So did they identify what was, how did that all work? I think is a really salient question.
Yep. And another devil's advocate question is, there in projects like this, there's always the difficult parsing of causation versus correlation. You maybe saved some money in some area, but was it because of this project, or was it for some other unrelated reason? And how do you decide which savings are attributable to the project?
Yeah, that's a really good point, Stephen. This one, I thought it took into account public health costs, which tend to be a little bit tougher and maybe more tangential. It did not. It really looked at the criminal legal costs and the cost of sheltering these individuals, which the city was already making expenditures on. I hear so many complexities about this, and one of the things that I think is innovative about this is the attempt with a scientific research study with random control to really prove a point that many people have been making for a long time. It is cheaper to house than it is to jail. And I think what this does, and I love the devil's advocate questions, and I love the critical thinking about it. And I also love that they went and did this, because I think they actually excluded a lot of other costs that one could attribute. Loss of tourism dollars to people living on the street. I mean, the list could go on for all of the money that it costs a society to have people be homeless. And they were really pretty narrow and focused. It seemed to be very targeted towards things that might be ascertainable. So I would argue they could have gone bigger, right? But how would you manage that? How would you recapture that? And more importantly, how would a municipality be able to take those savings and build more housing? Because that's really what we need to do. We need money to build housing for people instead of jail them. That's expensive. And how do we recoup those? And so any of the savings, Stephen, that would have occurred like in the emergency room, in all these other places where people frequent when they're not housed, that wasn't even considered. And it still saved money, and it still made a profit, and it kept those, 300 something, that the ones that received housing, 80% of them stayed in their housing more than 3 years. And the amount at which they were in the criminal legal system was a huge difference. So it definitely goes to bend the cost arc. And hopefully this will be powerful enough to kind of move some thinking and maybe get some more folks behind what Executive Sadhu brought up about this idea of the social bond as a way to fund more justice-involved housing.
Raylene?
Thank you. I agree with Tyler that we kind of need more information on the dynamics and how we're still going to need a jail, and it's still going to cost to operate it. But if we come back to the task force, it's the incarceration reduction task force. We want to reduce incarceration regardless of the cost. And if we can keep people out, from what I've seen over the last 30 years, I've seen families in the court system. I've seen the grandparents that were in the jail and then the parents, and now I'm seeing their kids, which is kind of dating me. But the recidivism is a family-oriented incarceration. And so if we can house somebody that we can keep their kids out of jail and keep the recidivism down, I think that's a start, and they're contributing to the community instead of taking away from it. So I think it is definitely worth looking into it. And thank you, Mike.
Tyler.
Yeah, I was just kind of going to reiterate that last point, Raylene, and Mike, you made me think about it when you said it, right? It's not investing in these programs because there's a cost savings on the other side. It's investing in these programs because there's going to be brilliant outcomes for that individual and for their families for the next, decades in the future. And so I think it just, this type of study just reiterates the reentry, the housing for those that are homeless or that are incarcerated is a very important part of the task force's work and the justice plan and where it goes. So,
yeah. Well, thanks, Mike. That's a fabulous thing you brought forward. I'm glad that we got to dig into that a little bit today. And we obviously, folks want to dig deeper, and we will be in touch with you next week. Jill and I will, to find out how we'll proceed.
Sounds
Anything
good.
else?
And I've got that report, Barry. Is it best just to send that to Jill and then she can send that out to any of the steering committee members?
That's probably always best to go through Jill. Yeah.
That's great. I'll do it.
Yeah. Thank you. Okay. One of the last items on our agenda today is the next task force meeting agenda items. This is Jenna. This is where Jill tells us what's on the agenda and we talk about it. Did she leave anything with you?
I'm looking at her draft of the agenda and it's looking pretty bare for September. It looks like there may be an update from the Washington State University Vera progress report.
Oh yeah, that's pretty major. So
yeah, but other than that, that's the only agenda item so far. So,
Well, one thing we communicated about was whether we wanted Kayla to make the kind of report and inquiry and expand the discussion on the legislative agenda to the whole task force rather than just this smaller group.
Kayla, would you be available on the 18th?
Yes, I am available on the 18th.
It's 9 to 11, so we could fit you in wherever in that.
Yeah.
Best for you.
Yeah, I'm flexible.
Okay.
And so we have this leadership planning topic.
Yeah.
I'll also say, both for right now and for then, that we have some non-leader members whose terms are expiring as well, and we need to plot out a recruitment strategy for filling coming openings on the task force. I mean, maybe we should spend a minute, if we have it today, thinking about how we want to structure that, or suggest that it be structured.
We have 4 minutes left, and I have to get to another meeting. So
okay, so that's not going to happen. Let's put that on our next steering committee agenda.
Anything else for the 18th that folks think of? Okay, so Jenna, you got those items?
yes.
I think our last thing is public comment. Is there anyone out there in public land that would like to speak to the steering committee?
Yes, we do have one attendee with their hand raised. So Jason, go ahead.
Go ahead,
Hey,
Jason.
good afternoon, folks. Jason DeForest, local business owner. How are you today?
Good.
Hey, good. It looks like for legislative requirements for police and healthcare worker accountability, that should probably be one of our major focuses. We've got to have these people helping these folks out there. And if they are out there helping them, they've got to be held accountable for what they do. We need the healthcare services in jail, the Medicare reimbursement. Does that carry on after jail. I think you guys were talking about that. I'm sorry, I'm hitting bullet points as I go, and I'm just reading what I wrote down, trying to get it all out quickly for you. That we need to make sure that they do have treatment. That should be a part of this whole community that you're talking about building for these folks. And the reimbursement that you're getting in, we need to have oversight for those funds, that when it comes in, that compensation needs to go to the innocent folks that were jailed improperly, and it needs to go to running these programs that you're talking about. It also needs to go towards jail improvements and maintenance. Talking about living, breathing human beings here. These are the people on our streets, right at our stoplights when we pull up, folks. These aren't, just random people out there. They are our community, and that's why we need to take care of them. Let me see what else I have here. For the task force leadership position, if you guys need help, I'm more than willing to step up and take over that. I'm a little nervous right now talking in front of you, but if I actually sit down and I'm invited to the group and allowed to chime in as we talk, I won't be forced to speak so quickly. And I would love to take on any responsibilities that you have. Mike, thank you so much. You make such a great point. To make it profitable to help people, that is what we need to do. Dan and Raylene, great points. We need to build and maintain normal living facilities for these people based on the restrictions and needs and requirements. Invest in the community, crime goes down, the need for police and the jail and emergency medical services all go down. Kayla, accountability, thank you so much. Stephen, good point. Need someone to develop sustainable living practices and show how it's feasible and maintainable. Paul said the money's there, so let's build these houses. Let's build these facilities for these people. They need to be based on those restrictions and requirements. If you have a group of sex offenders, make a small community for sex offenders and somebody that oversees that practice, right? And that's how we make sure that these people succeed after they come out of jail and that they don't continue to offend, that they feel like they're worth something, right? That we're going to take you out after you've done something horrible, and we're going to invest in you so that you don't ever do it again. One more time, just let me hit these main points. I apologize. I'm just trying to get it all as quickly as possible. Accountability, police and healthcare workers, jail condition improvements, civilian oversight, and cultural reform. Thank you very much, guys.
Jason, thank you for joining us today.
Thank you.
All right, everybody, we will see you at the task force meeting on the 18th. And Mike, Jill and I will be in touch.
Barry, if I could just ask Stephen and Jenna to stay back for just a moment.
Yeah.
I'm glad to. Tyler, I left a message for you to give me a call if you can. Would you do that? I know you're packed catching up, but
I got time this afternoon, Stephen. I'll give you a call.
okay, sounds great. Thank you.
All right, folks, we're adjourned.